Known for her expertise in cosmetic dentistry, General Dentist Dr. Marie Samaha is an associate member of the American Academy of Periodontology. She maintains her private dental practice, Port Warwick Dental Arts, and is also the founder and director of the Perio Arts Institute, a periodontal teaching and research facility in Newport News, Virginia. Believing that distinctive smiles deserve distinctive care, Dr. Samaha and her compassionate team of highly skilled healthcare professionals focus on giving you and your mouth the attention it deserves.
The mission of Port Warwick Dental Arts is to provide our patients with the highest standard of dental health care available in the most comprehensive manner. Toward that end, we feel it is our responsibility to consistently and constantly expand our knowledge and expertise so that we are able to offer that kind of care. Although I'm mostly known for creating beautiful smiles, one of the things I'm most proud of is that we pay close attention to the periodontal health of our patients. After all, we definitely do not want to be creating beautiful smiles on unhealthy foundations.
Millions of Americans diligently brush and floss each day, battling the onset of periodontal disease. But are these staples of oral hygiene effective enough? According to recent research, 80% of American adults currently have some form of periodontal disease, and while 50% see a dentist regularly, only 10% have been diagnosed with periodontal disease, and a mere 1% are being treated for their contagious infection.
The reason periodontal disease is so rampant is because in the mouth we have the most delicate tissue associated with the most aggressive bacteria that lives anywhere in the human body. It's a volatile combination. Periodontal disease is a contagious infection that can be passed from person to person through kissing or eating, drinking after one another. We now know through thousands of pieces of research done all over the world that periodontal disease can encourage many systemic diseases such as heart disease, heart attack, stroke, high blood pressure, diabetes, pulmonary disease, and many, many cancers. It also can encourage the preterm birth of babies and infertility in men and women. The reason periodontal disease is not being treated is because the symptoms often do not show up until the middle or late stages. At that time, it's already aggressive.
Now, there is a newly emerging standard of care. Here at Port Warwick Dental Arts in Newport News, Virginia, Dr. Marie Samaha and her team have developed and practice a leading-edge protocol for the diagnosis and treatment of periodontal disease.
Our protocol for treating periodontal disease includes targeted nutritional supplementation. It includes blood testing, DNA testing, and laser therapy. With a disease that's considered incurable, like diabetes, periodontal disease requires that individualized attention. The results we see are incredible. I've been practicing dentistry for over 26 years and been very tuned into periodontal health. With the combination of the multifaceted program, we're able to see a stability in our periodontal patients that we have never, ever experienced before, and neither have they.
Unlike the traditional generic approach of treating periodontal disease, Dr. Samaha feels these newly developed diagnostic testing methods offer a patient more all-encompassing, individualized periodontal care based on one's specific health.
It's so important to embrace the new technology that we have available to us in exploring and diagnosing and treating periodontal disease, because in the past, periodontal disease would reoccur and reoccur, and we as dentists were constantly revisiting this disease process with our patients. We no longer have that kind of frustration. Our profession has been fairly resistant in embracing new technologies such as the use of lasers for treating periodontal disease and the use of DNA testing and so forth. It really requires a major paradigm shift because this is not something we have ever been able to do in the history of periodontal therapy. We also want to act responsibly when caring for our patients. That's why at the Perio Arts Institute we have developed the research division. and all of our research has fully substantiated our entire protocol.
Okay, so we're back again today for some more exciting information.
Preaching what she practices, Dr. Samaha has also developed her own approved professional teaching facility. At the Perio Arts Institute, Dr. Samaha teaches and arms fellow healthcare professionals with all of the new standards of care needed to successfully combat periodontal disease.
I've been teaching dentists and other healthcare professionals, including physicians, for over 25 years. In the past 3 years, though, our protocol for treating periodontal disease has become so effective that I began teaching other dentists what we do. When I started to see the results in our patients' care, I felt obligated to share that information with our profession, and I am definitely on a mission. I refer to our seminars as PerioPassion seminars because we have a lot of exciting information to share. In the past, the treatment of periodontal disease was at best a boring topic. It's not that way anymore.
This is going to be an incredible opportunity for your practice to soar to an entirely new level of patient care. There will not be an opportunity for your practice to succeed in pursuing this care for your patients unless every one of you is intimately involved with the process.
It's been an extraordinary journey. I feel like we have definitely established our place in this region, and we also enjoy a national reputation. Our patients are able to fully relax in our treatment rooms because they get to look out into a beautiful meditation garden. We have a koi pond view from every treatment area, and they just find it so soothing. The dentists and the teams that we have taught our protocol to are extremely excited. They're seeing the same results that we've seen, and it just makes it so worthwhile for me as their teacher to be able to see their success.
A few months ago, I was admitted to the hospital 3 times within a week, doctors thinking I had a heart attack. Because my symptoms were so severe, the doctors admitted me to the hospital for days and started me on a series of MRIs, IVs with antibiotics, and extensive lab tests. Prior to being released at the hospital over here at the last time, I was beginning to have a toothache, and the doctors suggested that I might try Dr. Samaha. When I came to see Dr. Samaha, she found out I had a severe periodontal infection and I had to remove my tooth. The periodontal infection had poisoned my bloodstream, and the test showed that I could have died from it.
In fact, Mr. Stallman's CRP blood test showed he was at extremely high risk for a heart attack or stroke at the time of his hospitalization. A normal reading of a CRP test would be a 1. Mr. Stallman's CRP was an alarming 42.44. Only 10 days after beginning treatment with Dr. Samaha, his CRP was reduced to a 0.65, well under the normal limit. Mr. Stallman considers Dr. Samaha's treatment truly life-saving for him.
Dr. Samaha started me on a treatment of nutrients, laser treatments, and extensive brushing of the teeth and the gums. Dr. Samaha has been treating me for the last 3 months, 3.5 months, and I feel great and better than I have in years, and I can at least smile now and show my teeth.
We're very excited about what we do at Port Warwick Dental Arts. It is an extremely unique opportunity for patients because we do offer very comprehensive care. What I love most is to be able to take a patient with extraordinary disease full circle to total health. At the Perio Arts Institute, we are so excited about sharing our message with more practices throughout the country. I truly believe that what we are doing is setting a precedent for the future care of all of our patients in this country and then worldwide. Periodontal disease is a serious and even life-threatening disease. It's silent until its middle to late stages, so we don't know we have it when we do. Most of all, it does not discriminate. It can affect anyone. I want to encourage everyone to seek out dentists and physicians who are experienced and knowledgeable in the mouth-body connection. These practitioners are some of the most progressive leaders in our profession.
There's a new emerging standard of periodontal care in the field of dentistry, and Dr. Marie Samaha is bringing it to you. Find out more about Dr. Samaha's practice and seminars today. For information about Dr. Samaha's private practice, call the number on your screen or log on to pwdentalarts.com. For dental professionals wanting more information about the Perio Arts Institute, call the number on your screen or log on to perioartsinstitute.com.